So this is going to be posterior thighs and then legs.
That's right.
Looks like. And, you know, the legs are not an area to begin with for beginners. It's an area for intermediate and advanced liposuction surgeons. In fact, there are some liposuction surgeons that never do legs at all. Here you can see the VIBERSAT, which is a reciprocating, a vibrating liposuction cannula being used to treat the lateral leg compartment. And there are multiple incisions that will be made on the leg in order to target this fat. Here we're treating the medial ankle and the medial leg from an inferior incision, and this needs to be done very carefully and very gingerly with all of these tunnels in the long axis paralleling the blood vessels and the nerves and the lymphatics, because if you damage those structures, the patient is going to have prolonged lymphedema.
Yeah. But very crucial point is that we have to have enough tumescent local anesthesia to widen the surgical space, since space in the ankle region is very limited. And infiltrating in that area sometimes gives you a problem, since the medial part is infiltrated, but then you get to the lateral part and then there's not much skin flexibility left, so you can't really get too much fluid in. So it is recommended that maybe if you have a big case, you do the inner thigh and inner calf in one session, and you do the outer thigh and the outer calf in a second session, so you not run into that problem.
So then you preserve the lymphatics in,
Yes,
in one half of the
absolutely.
leg.
Because you have more tumescence, and the more tumescence you have, the more security you have for your tissue. Also, it's very good advice to have not too many incisions and have quite a continuous suction throughout the whole calf, if your cannula is long enough, to have not too many entry points, because they intend to heal differently and with indentations which can be disharmonious in the contour of the calf.
The liposuction book that accompanies this videotape is meant to be an international comparison of liposuction techniques, and people do things differently. You know, here it's very atraumatic, using a powered cannula, using a 4mm cannula, whereas there are other people that might prefer not to use a powered cannula and to use very small cannulas, perhaps 2 millimeters in diameter. And this is a matter of personal preference and experience. The fat is subcutaneous on the leg, so you don't have to poke through to any deep compartments with risk to the deeper structures.
Mm-hmm. One thing might be important to mention, that you will access the dermis gradually from deep down, and you're moving yourself up, and it comes to the point that suddenly you might remove the last sheet of fat, and then you see like a line which is over resected. Well, this is the point which will be compensated by the wound healing, but tells you definitely to stop the fat removal in that area. And this is actually the end point for the calf, different to any other areas in the body where you can see that.
Yeah, and this is the emphasis of one of the previous principles, which is to suction the fat deeply and not superficially. And the other important principle is to suction in the same direction as the nerves and lymphatics, so as not to damage those structures.
Also very interesting to see that we're approaching now the lateral part of the knee, and especially when we are removing fat from the medial part of the knee, the knee seems to appear still too wide because the lateral part is not removed. So in order to reconfigure a beautiful knee, you approach the lateral part from the lateral calf part and remove the wrist so the knee appears harmonious again.